Good morning and a warm welcome to today's COVID-19 update by the Ministry of Health. The presenters this morning are the Honorable Terence Dayal Singh, Minister of Health, Dr. Roshan Parashram, Chief Medical Officer, Ministry of Health, and Dr. Joanne Paul, Regional Coordinator, Emergency Medicine, NCRHA. I am Al Alexander, Senior Corporate Communications Officer at the Ministry of Health, and I will be your moderator for this morning's COVID-19 update. We will begin with Dr. Parashram, who will provide the latest clinical and vaccination updates, followed by a presentation on the Pfizer COVID-19 vaccine. CMO.
Hi, good morning, Al. Thanks very much. Good morning to the Honourable Minister, Dr. Paul, members of the media, members of the viewing and listening public. I'll begin with the first slide, which gives the clinical update for August 15th, 2021. Total number of public and private tests done so far, 288,131, with 119 new cases reported over the last 24 hours, taking our total since March 12th to 41,676. Our total recovered patients, 34,351. Our active positive cases, 6,152. Total positive patients in hospital, 303. And those in step down, 105. The number of deaths now stands at 1,173. And of course, condolences to all those who would have lost loved ones during this time. The total at state quarantine facilities, 127, and those persons in home isolation, 5,596. Next slide. So, just as is customary when we have a new vaccine coming into the country, we give a brief summary of some key characteristics of those vaccines. So the latest arrival, the Pfizer-BioNTech COVID-19 vaccine, also known as the Comirnaty vaccine, manufactured by Pfizer and BioNTech, is the first COVID-19 vaccine to receive EUL by the WHO on the 31st of December 2020, and the first to be approved in persons under the age of 18. The platform is a nucleoside-modified mRNA platform. Next slide. So again, if you compare to other types of platforms, the AstraZeneca, which we have in the country, is an adenovirus platform. Sinopharm is an inactivated virus. mRNA never enters the nucleus of a cell where the DNA genetic material is found, and therefore DNA cannot be altered by using this vaccine. Next slide. So the recommended schedule, 2 doses, like the Sinopharm and the AstraZeneca, 0.3 mL in each dose, 21 to 28 days apart, very similar to the Sinopharm vaccine. Next slide. Interchangeability and WHO's approval. It has been given approval by WHO to use the AstraZeneca as a first dose and the Pfizer-BioNTech as a second dose. Bearing in mind the national policy for now is to, at best, try to use the first dose and the second dose of the same vaccine where supply allows for that to be done. Next slide. Vaccination, of course. Initially, this vaccine was approved on December 31st, 2020 for persons 16 years and over by the WHO. Subsequently, on June 15, 2021, it was granted expanded use to the 12 to 15, meaning that it can be used on any person above the age of 12. And authorization in Trinidad is for that age group, children from 12 and above, including adults. Next slide. Side effects. Common side effects are pain at the injection site, fatigue, headache, muscle pain. Very rare side effects include myocarditis and pericarditis. In the lower limits, there may be as little as 1 to 2 cases per million. Based on the age group and the type of person, male or female, there's variances of that. Next slide. So contraindications, a history of anaphylaxis to any component of the vaccine is a contraindication to vaccination, or previous at the first dose if you have a allergic type reaction. Generally, we advise that before you have the second dose, you consult with a physician. co-administration with other vaccines, a minimum of 14-day interval between this vaccine and any other vaccine against other conditions. Next slide. So vaccine efficacy, most of the clinical trials were done 7 days post second dose. Just remembering at this point, we consider a person to be fully vaccinated when they would have had the requisite doses followed by a 14-day period, which is WHO's recommendation. This basically is just based on 7 days post second dose at a clinical trial. So it gives 95% efficacy against symptomatic disease in persons 16 years and over, and close to 100% against symptomatic disease in those 12 to 15. So you see, the younger you get, the better your immune response and the better the protection. Next slide. Vaccine efficacy in the real world studies 7 days post the second dose, 72% for infection reduction, 94% for symptomatic disease, 87% reduction in hospitalization, 92% reduction in severe disease. Next slide. Again, vaccine efficacy against variants, 88% effectiveness against symptomatic disease caused by the Delta variant, 93.7% effectiveness against the symptomatic disease caused by the Alpha variant, which is the UK variant, 75% effectiveness against the symptomatic disease caused by the Beta variant, which is the South African variant. Next slide. So, of course, this is the last slide, and just to remind everyone, doesn't matter which vaccine is available to you. Once you have no contraindications to it, you take it when it is available to you. Thank you all.
Thank you, CMO. And I now hand you over to Dr. Joanne Paul, also head of the Pediatric Emergency Department, Eric Williams Medical Sciences Complex, who will speak on the benefits of vaccinating children. Dr. Paul.
Good morning, Honorable Minister, Chief Medical Officer, members of the media, ladies and gentlemen. If you can start the presentation, please. Today, I'm just going to discuss with you about the vaccines in children in terms of the Pfizer vaccine. Next slide. So CMO just went through the differences, and I'm not going to repeat what you were saying, but just to mention that the traditional ones, the Sinopharm, is just very similar to the polio vaccine. So we've had vaccines all our lives. Our children usually have vaccines, and that's the traditional one, while we have the AstraZeneca and the J&J are the different ones, and of course the Pfizer one, which is the newest one. But if you look at it carefully, although we think it's newer, it's been around for maybe about 30 to 40 years now. And technology has been there, and they have used it for Zika virus in addition to influenza, etc., and rabies. So it's not new at all. Although we think it's new, it's newer, but it's really old, and it's still technology that's been coming up so far. The whole point, though, just to reiterate about the vaccines, is that you use a vaccine which is a form of the virus, either the virus that is inactivated, or it's a point or a piece of the virus, and it's what it's supposed to do. It makes your immune system react to that piece or that form of the virus. And when it does that, it then remembers it. So when you're exposed to the real virus, that's when you have stronger protection. So that has been there all the time. And in fact, children are very strong in terms of responding to these vaccines. They handle it very well, and we have had an entire history of children and vaccines and no issues whatsoever. Next slide. As we look at in terms of the rollout of the Pfizer vaccine, as CMO just said, it's been the one that's been WHO approved for vaccination in children 12 to 17 years old. And if we look at it now in England, they also started to roll out, and they're going to give their targeted population. The difference with England, though, is that they have a really high vaccine uptake. They're about 75% in terms of full dose, and we have about 90% in terms of those who have had their first dose. So what they decided to do is targeted. So they're giving mostly those children who are vulnerable, high risk, or those who actually live with someone who is also vulnerable, and that's their thought process. Next slide. In comparison, though, in USA and in Canada, they have had inconsistent uptake of the vaccine. So some states have had low vaccination uptake, and they've decided it makes more sense for herd immunity in the sense that to make sure all of the children 12 to 17 years old are actually eligible to get their vaccine and have that increased protection. Interestingly enough, though, USA have had much more cases of MIS-C. Remember the thing we mention all the time, the multi-system inflammatory syndrome in children. And they have seen that, and they responded to that. So they find that they want to make sure they have increased protection with regards to their children, which is the process we're following right now. We're looking at the focus on all children, but we want to focus also especially on those vulnerable groups. I'm going to list them out. So for parents who have children who have diabetes, hypertension, Down syndrome, obesity, heart disease, asthma, kidney, cerebral palsy, weakened immune system, and also sickle cell disease and other medical conditions, you fall in those vulnerable groups. So we're looking at those, or if the child lives with someone who is also high risk. Next slide. So we speak about myocarditis and pericarditis, and everybody's been talking about that in terms of they've seen a few cases with the Pfizer vaccine. But if you look at it, I've really reviewed the data, and it's a rare event. It's 1 to 2 per million population. The cases have been mild, mostly mild, and they've all recovered. What they've seen, though, it's usually found in young adolescent male and young adult male, maybe 25 years old. It's about 2 to 3 days after the second dose of the Pfizer. It's very uncommon. So what I try to do when I come to speak to you on mornings like this, I make sure I have the data, the research, also speak to the on-the-ground person. So I make a call to my colleagues in Canada, USA, UK, and also even Australia. And I spoke to one of the professors in US right now, Professor Marian Gouch-Hill, and she mentioned that on the ground they have been handling with the Pfizer, and they've had almost no cases of myocarditis. And the ones they've had they're very mild. They have been more concerned about MIS-C and also about COVID infection in children. Next slide. Now we have to, just from a perspective point of view, although we're looking at the complications, we have to understand, as I mentioned in the beginning, that the vaccine is meant to be a milder or a piece of the virus. So it makes sense that some of the complications, milder, rare complications, will be stuff that the COVID infection actually already does. So in fact, COVID causes myocarditis, causes clots. Long COVID has myocarditis in it, and also has effects on your lungs especially. Then we have the MIS-C itself. That also causes inflamed blood vessels and also myocarditis, and it has a whole multi-system approach in terms of kidneys, etc. It causes brain to be inflamed. So what I'm saying is that it's not surprising, but look at the ratios. MIS-C and long COVID and Delta, lots more effects, and in terms of the complications of the vaccine, very mild, very rare, but it makes sense since it's a milder version of the virus itself. Next slide. Next slide, please. Yeah, so as we go on to talk about infections, just for your information, I know you've seen your information on television and reading the news on newspapers and also on social media. The fact is that the Delta variant is highly infectious. It is what we've been seeing in U.S. right now, increased infections with young people and children, which we haven't seen before. They're actually not sure what's the reason. They think it might, is it because the Delta variant, it makes the children more sick? Or is it that with the high infectivity, they're going towards the ones that are unvaccinated? But significantly, and most interesting, UK, England is not seeing that much of a trend. Now, they're seeing increasing infections, but not such a drastic increase in hospitalizations and effects on the children. So we have less infection, less hospitalizations, and less MIS-C in England, where you have a higher vaccination uptake. So the key here, even though the variants are spreading all over, the key here, I think the game changer is herd immunity with the vaccinations. The more we have, the more we protect our children and our elderly and our young adults. So right now in UK, USA, they have even 15 to 20% of the new cases being children who are in hospital, who are coming through, which is very, very different. Next slide. So in terms of your child and vaccination, I want you to think about the various groups, what category you fall into. If, for instance, your child is above 12 years old, 12 to 17, well, 12 to 18 years old, and your child falls into those high-risk categories we mentioned already, definitely take your child to have your Pfizer vaccine and be vaccinated. If your child is living with someone who is also ill, who has comorbidities, who is a high risk, take your child also. If you have compared the data and you realize that Delta, the chance of infection with Delta and also infection with having MSC is high, and you do your risk-benefit analysis and you realize that, hey, it makes more sense, take your child to get the vaccination. But if you're unsure, I'm saying have a conversation. Do not go to check on social media for some person in Timbuktu who purports to have all the information. Talk to your pediatrician, your doctor, your nurse in your area, get your facts, get the information, and be prepared. So in terms of be prepared, have your Panadol available at home, have your ibuprofen, have your fluids, your Gatorade, your coconut water, your G-Sol. Don't give your paracetamol at the same time. Once they have the vaccine, take them home. If they have symptoms, you should give, if they have soreness at the site, or if they're having some fever, that's fine to give it beforehand. Don't give it beforehand. So you're prepared in that sense. What I also recommend is that you can have a check-in. Be prepared and at least actively monitor. Have a checklist, liaise with your pediatrician or your health provider, WhatsApp them. Every day, do I have any chest pain? No. Palpitations? No. Do you have any shortness of breath? No. Any fever, any sore throat? Do a check. My child is fine. Do a check for a few days. And significantly, don't have any activity for that week. Make sure it's light activity. We don't want to have any 5Ks being run. And once you have the vaccine, take it easy for that week. Less activity. No, even for the athletes out there, be restful for that week and just relax. Next slide, please. So in summary, I'm here today. I did my recon. I spent all my time to make sure I come and talk to the population to see if Delta is coming up. Delta is here, and we're going to have increased amount of cases coming to the hospital, and infectivity is higher. The Pfizer vaccine, it does cause in a few cases myocarditis, but it's very rare. It's 1 in 2 per million. Now, if we have 100,000 children in terms of secondary school age children who are between 12 and 18, that means it's 1/5 of a person to get myocarditis. In terms of if we were to vaccinate all our children between that age, it means that we'll have to vaccinate the entire Caribbean to actually have one case. It's so uncommon. And if it does happen, it's mild. It's also all recovered. So I'm not concerned at all. I'm more concerned about the herd immunity aspect. So I want to reiterate the trifecta or the triple. It's 3 things to do. 1, the public health measures. Remember to wash your hands, wear your mask, watch your distance. Number 2, vaccinate. That's actually cornerstone in terms of seeing what UK has been doing. Vaccinate to have that herd immunity so we protect all of us. And thirdly, don't forget about your internal immune system. It doesn't make sense to eat crap food, don't exercise, and your immune system is not strong. Make sure you have low stress, exercise, be healthy, and strengthen your own immune system. And the last thing, I do understand, for those out there who do have concerns, just have a conversation. Call your pediatrician. Tell them your concerns, get the facts, listen, and make your decision. Thank you very much.
And thank you very much, Dr. Paul, a very engaging presentation. Thank you very much, Dr. Paul, a very engaging conversation. We thank you very much for that. We close off this morning's presentation with the Honorable Terence Yalsing, who will address some of the developments surrounding the recent shipment of Pfizer vaccines and the rollout of these vaccines to children between the ages of 12 and 18 years of age.
Thank you very much, Al. Good morning to the Chief Medical Officer. Good morning to Dr. Joan Paul, my colleague. Almost said good afternoon. Good morning, ladies and gentlemen of the media, and to Trinidad and Tobago, wherever you are, a very good morning to you. Before I go into the rollout of the Pfizer vaccines for our children, let me bring you up to date on where we are with the figures for our national vaccination drive. As of yesterday, Sunday 15th, and the weather was absolutely horrible yesterday, which would have affected us as it has been for the past few weeks. We did 1,579 first doses yesterday. So our total first dose count is 454,085 doses, which represents roughly 32% of the general population of 1.4 million. Second doses, yesterday we did 13,819, so it was a good day for second doses. That brings our second dose count up to 320,425. That is 23% of the population. So I really want to thank and congratulate all 320,000 persons who are now fully vaccinated. You are our heroes because you now stand less than a 1% chance of contracting severe COVID, of dying from COVID, and being in an ICU due to COVID. Because what vaccination does, it gives you 99% protection against either being a mortality statistic, developing severe disease to go into a hospital, and needing ICU care. I just want to put our vaccination numbers in some sort of context to reinforce what both CMO and Dr. Paul have been talking about, and all of us, about the safety of vaccines, risk versus benefit. In the 30-day period from the 15th of July to yesterday, which is basically a month, maybe about 31, 32 days, we administered 222,882 first shots. Bear that number in mind. Second dose shots from the 15th of July to yesterday, the 15th of August, we administered 173,753 shots. It means over that period of roughly a month, we administered 396,635 shots. Why is that number important? It is important for the following reasons. In the same period, there were 211 deaths. 211 deaths, but in 396,635 shots, I just asked the CMO, we have had no reported adverse events, adverse effects. Yes, some would have gotten side effects like fever, soreness, tiredness. But let's weigh it up. 396,635 first and second doses administered in 1 month, no adverse events, no one who is fully vaccinated has died from COVID, but we have had 211 unvaccinated persons who unfortunately have succumbed to the disease. So ladies and gentlemen of the media and all of Trinidad and Tobago, the numbers speak for themselves when it comes to weighing risk versus benefits. And the risk is so low and the benefits are so high, we encourage you, please, to get vaccinated. I now want to turn to what Al has spoken about. How are we rolling out, together with the Ministry of Education, our vaccination drive for the Pfizer vaccines? So just as a background, Dr. Paul would have told you about the safety profile of the Pfizer vaccines. We have enough of them to vaccinate our entire population of 12 to 18-year-old persons. So the first point to make is this. We are vaccinating every person, or we want to vaccinate every person between the ages of 12 to 18, regardless of your school status. What does that mean? If you are 12 to 18 and in school, it's open to you. If you are 12 to 18, you are not in school, it is open to you. If you are 12 to 18, you're a child of a migrant, whether you're a Venezuelan migrant, whatever, it is open to you. It is open to everybody in Trinidad and Tobago, regardless of your citizenship status, your residency status, whether you're a migrant or anything, it is open, open, open. As we roll it out, of course, we must have parental consent, which is much different to when I was young and going to Caroni Presbyterian School and Cura Presbyterian School. In those days, the district health visitor used to come to the school, inject you, vaccinate you, give you a card, and you go home and tell your parents, "Ma, I get vaccinated today." But times have changed. That is how it used to be done long ago. So vaccinations for children, even at the primary school level, is nothing new. But we must have consent. The child must bring in, or the parent of the child must bring in their birth certificate and so on. We are asking that when we open this from Wednesday, and I'll go into details very soon, there is no appointment system. You come into the sites, which I will identify in a very short while. But to manage crowds, we are asking that one parent per child or per household, if you have 2 or more children in that age group, one parent come in with the minor. That will help us manage crowds and help us maintain social distancing. So please, parents, guardians, please work with us. One parent or one guardian per child or per children under your remit. I will now ask for the slide to go up where we can see the centers that we are going to use. We are going to be using 13 centers throughout Trinidad. Tobago, of course, will have their own particular setup. In the north, we have 3 centers. So 5 and 3, 8, 14 centers in all. 3 centers in the north. The heliport in Chagaramas is a drive-through. So you just drive through, you get your vaccine, and you drive out. Costat City Campus in Port of Spain, and Napa in Port of Spain. So we have 3 good sites for those living in north, from Chagaramas all the way to Laventil, Sawa, and so on. In the east, we have 5 sites. The Costat El Dorado campus in El Dorado. Wallerfield International Raceway, again, a drive-through site, very convenient. Larry Gomes Stadium in Arima. Duranta Gardens Community Center in Sangre Grande for that part of the country. And if you live on the northeastern coast, the Lansnor Community Center in Toko. So we try to spread the sites as much as possible, urban areas, city limits, and rural areas. In Central, we have the Diwali Nagar site. Now, just one proviso with Diwali Nagar. That site will be up from Sunday 21st. So that site will not be available initially. It will be up from Sunday 21st because of the issue with volunteers and so on. We have the Atto Bolden Stadium in Couva. And in South, the Pleasantville Technology Center in San Fernando, MIC. the Hansraj Sumer Singh Multipurpose Complex in Rio Claro, the Mayaro Civic Center for the Southeastern Peninsula, and for the Southwestern Peninsula, you are not left out, the National Energy Skills Center, NESC, in Labrie. So we have set up these 14 sites throughout Trinidad, trying to reach people living within city limits, boroughs, urban areas, rural areas. The actual vaccination program starts on Wednesday, this Wednesday, at 8 a.m. No appointments. We are trying to make it easy and break down barriers. But we do ask, again, one parent per child, or one parent if you have more than one child in the age group 12 to 18 being vaccinated. That will help us with crowd control, social distancing. So that, in a nutshell, is what the Ministry of Education and the Ministry of Health have come up with to vaccinate this age cohort between 12 and 18 starting from Wednesday. So take advantage of it, because as Dr. Joanne Paul would have told you, the Delta variant, if and when it becomes a community issue, the children of this country are the ones who are going to bear the brunt of it. We, all of us at Health and the RHAs, will not like it if 5 weeks from now, 6, 7, 8, 9, 2 months from now, we hear about a child in this 12 to 18 cohort who has passed from COVID. Why? Because we have a solution. No child 12 to 18 in 5 weeks from now, because you administer your first dose, 3 weeks for your second dose, and then 2 weeks to be fully vaccinated. So in 5-week rolling intervals, we should not be hearing about any child, any of those precious children. And if as a parent we love our children, the same way we vaccinated them at one, how young do we start them off? A month?
About 2 months or so for the youngest, 2 to 3 months, yeah.
So if every parent already had their children vaccinated at 2 months, because I'm hearing all sorts of things about these children are too young to be vaccinated, but we have been doing this for decades. Every single child in this country was started off their vaccination program at 2 to 3 months. Now we are trying to protect tomorrow's leaders, the future of this country, from this virus called COVID-19 and the Delta variant. Let us, as a country, protect this cohort of children. Parents, if you love your children, the same way you vaccinated them at 3 months from measles, mumps, rubella, polio, yellow fever, whooping cough, and tetanus, is the same thing we are asking you to do now. Very little has changed. So I just want to make a plea to parents: get your loved ones, your children, between the ages of 12 to 18 vaccinated. Thank you very much, Al.
And thank you very much, Minister. Ladies and gentlemen, the next portion of today's media conference will be devoted to question and answer from the media. I would like to ask our media representatives to begin by stating your name and the name of the media house that you represent before you put forward your questions to our panelists. Because time is always limited, we ask for no more than 2 questions per media house in the first instance. And of course, if we can, we will allow an additional question from media representatives. We begin with questions from AZP News. Good morning, Priya. Priya, we're not hearing you. Could you unmute?
I am on mute.
Right, we're hearing you. Good morning.
You hear me now?
Yes.
Yeah. Good morning, Priya Bihari, AZPnews.com. My 2 questions should be for the CMO. I want to find out about the contact tracing that has been done for the 3 cases of the Delta variant? Are the people who were on the plane with them, all the passengers and the crew members, would they also have to be in quarantine? And my second question has to do with the testing, the genome sequencing testing for the Delta variant. How is that chosen? Is it that people who come from high-risk countries and who are positive but are unvaccinated? Thank you very much.
Okay, sure. Okay, thanks, Brian. So begin with how we test, right? So basically, as we said before, we test for not only Delta, for any sort of variant of concern based on anyone who is positive from a repatriation flight coming into the country recently, or anyone who presents with sort of unusual symptoms. For example, the age groups are lower than we expect. We would send those for testing to the University of the West Indies lab. Of course, with other unusual clinical presentations, possibly deaths in lower age groups where we find that there are no comorbidities, for example. So any unusual presentations, all repatriations, all persons coming into the country. At least at this point in time, we do some random sampling if we see unusual clusters occurring as well. With regards to the 3 cases, so as we said before in the press releases, all 3 cases were persons who would not have been fully vaccinated in coming into the country, so they would have been put in the stream of unvaccinated individuals. Therefore, they would have had to go into a quarantine scenario, have your negative PCR 72 hours before you fly, and then you go into a quarantine hotel for 14 days. When we did our 7-day swab on those people, we would have gotten a positive, and those would have been sent, based on the protocol, to be sequenced at the University of the West Indies. Any positive person from the repatriation flights who are in a quarantine hotel or even outside would be treated as if positive or suspect for a variant of concern until otherwise proven by the University of the West Indies. As I have said as well, there's a different discharge criteria, so we have a double negative which we used in the past. We're making sure those people have 2 negatives before they are allowed home to decrease the risk of transmission of that particular variant. As it relates to the question on travel, so the CMOH for the Sir George East, who has oversight for the airport, has some discretion as to who is tracked based on their exposure. So generally speaking, as we have the 72-hour PCR in place, the risk of spread on an aircraft, together with the public health measures, meaning everyone has to wear a mask for the duration of their transit at least, that the risk of transmission of the disease at that point in time is mitigated to a great extent. However, the CMOH will do some reverse tracking and contact tracing of those individuals if he deems that that is necessary based on the risk, and has that level of discretion. Generally speaking, as a rule of thumb, the risk is extremely low. And of course, it is based on your vaccination status as well. I hope that answers the question.
Thank you very much, CMO. We quickly go to CNC3 for your 2 questions. Good morning.
Hi, morning everyone. Rashad Khan here from CNC3 News. So both my questions this morning are for Minister Dialsingh and the Chief Medical Officer. So my first question is, seeing that we looking on to the United States when we're looking at the evidence for how the Pfizer vaccine has worked in children, is it a position where we would be considering doing just like the United States, upon the CDC's recommendation to vaccinate pregnant women as well with these doses? And now my second question, there's just a follow-up to what Prior would have been pursuing there. Considering what we know about the Delta variant and its propensity to be transmitted even within fully vaccinated individuals, has any sort of discussions come up pertaining to our entry protocols to probably adding an additional layer of security to persons who enter into the country who are fully vaccinated? Or if it has come up, could you tell us why it wasn't implemented if it was? So thank you.
Thank you, Richard. I will take the first question about us following the United States. I think Dr. Paul was crystal clear that she reached out to both the United States and the UK and other practitioners in other countries, Richard. So let's make that absolutely clear. We don't rely on evidence from one country alone. She was very, very explicit that she reached out to United States, UK, and other practitioners in other countries, as we do also. I want to thank you for the question on pregnant women. As Minister of Health, I advised the Chief Medical Officer last week. So let's go back in time. About 2 months ago, a meeting was convened with CARPHA, PAHO, all 5 RHAs, OBGYNs, and the private sector OBGYNs to talk about the whole issue of pregnancy, lactating women, and vaccinations. Coming out of that, and looking at the international evidence, including WHO, we took a decision that, in keeping with best practice, that the Sinopharm vaccine could be administered to breastfeeding mothers. Last week, I actioned the same process. I asked the Chief Medical Officer to convene the local TAG group, Technical Advisory Group, under the technical guidance of Dr. Adesh Sirju about the issue of vaccinations, whether it's Pfizer or any other, and pregnancy. The TAG group made a recommendation, which I read this morning. We are having a roundtable discussion tomorrow with the stakeholders. Who are the stakeholders? PAHO, CARPHA, OBGYNs in the public sector and OBGYNs in the private sector. That is taking place tomorrow morning, and out of that will come a consensus position on the use of the Pfizer vaccine in pregnant women. So that is what we have done at the ministry, dotting all our I's, crossing all our T's, and hopefully by Wednesday, whoever is at the press conference on Wednesday, if there is consensus on Tuesday, a particular position can be put forward to the country and its pregnant population. Thank you very much, Rashad.
All right. Yeah, I think he has a second question relating to the layers of security on the quarantine, persons coming into quarantine. So generally speaking, it's a rather rigid quarantine process for someone who is unvaccinated or deemed not fully vaccinated. 14 days in a state-supervised quarantine facility. We do a test on day 7. Those vaccinated individuals who would have had a negative PCR before, what we found when we were observing the trends for the last 6 months or so, since the introduction of the negative PCR, we have gone down to a pickup rate of 0.83%. This is before the opening of the borders. So of people coming into the borders, it was approximately 4,000 people at the time. We had a pickup rate, meaning a positive at day 7 of 0.83%. Unvaccinated and vaccinated, the majority of those, if not all of those, would have been people who were unvaccinated. So based on the evidence that we had before us and the new studies that have shown that certain vaccines offer protection from infection, and they have decreased the likelihood of spread even if you are infected, we made the policies based on that. Of course, there's a possibly 1 in 1,000 chance of someone coming in who is vaccinated can be, of course, infected and spread. So there's no quarantine process in the world that will give you 100% protection by just having a quarantine process in place. But you have to look at the resources that you put out. You have to look at the movement of people. In terms of an IHR perspective, they have always said that you look at the movement of people and the restriction of the movement and the way people move as you develop your policies in terms of quarantine. So having said all of that, I think there's another proxy indicator that we have to look at. As you know, the children that come with vaccinated adults, they have to have a swab at day 3 to 5 as well. And we have found that only 3 persons out of about 300 so far have been positive. They were asymptomatic, the children. And when we tested the adults who were vaccinated came back as negative. So it gives us a good idea of what is happening with the vaccinated people that are coming through as well. And generally, it is comforting to know that they were negative as well at that point in time. So the quarantine will remain for now. And of course, we'll continue to look at the data coming to us with the new variants of concern and amend as we see necessary.
Thank you very much, Minister. And CMO, we now go to the Newsday for your two questions.
Hi, morning, Clint Chantak of Newsday. My two questions again will be for the Minister and for the CMO, and it's actually part of my first question is a bit of a different dimension to an earlier question. So I wanted to ask, well, based on the number, we already have 3 known cases of the Delta variant. So is the screening process, apart from the quarantine, is that robust enough to make sure that we don't miss anybody and these people slip past us and they get into the community and we could possibly see cluster or community spread? So my first question is that screening robust? Is the current screening for people entering the country for COVID or any variants, is that robust enough? Do we need to strengthen it in any way or in any kind of way? And secondly, given the types of challenges that the parallel health system has been facing, what is it? How is that system able to deal with any potential situation of cluster or community spread of the Delta variant?
You could go first.
Okay, so I will take the second question first about the hospital system. You know, the ability of the parallel healthcare system to cope with any cluster. If you had asked me this question 3 months ago, I would have said, the government has all the responsibility to do this, to add beds, to manufacture nurses, to snap your fingers and create 1,000 more doctors, to snap your fingers and find 500 more nurses. That would have been my response 3 months ago. But 3 months later, in answering that question squarely, the responsibility is now where? Not solely with the government, but with the population to be vaccinated. The best way to protect the entire healthcare system, not only the parallel, because in other countries, they are now sending pregnant women home and turning away cardiac patients and turning away orthopedic patients and turning away people who need this and that to convert their traditional hospitals to COVID hospitals. That is our fate in Trinidad and Tobago. If the population who now has armor and ammunition at its disposal, and what is that? A WHO-approved vaccine. So as I said, 3 months ago, I would have said the Minister of Health had to snap his fingers and find 500 more doctors. Snap his fingers and find for every doctor, you probably need about 3 nurses. Find about 1,500 nurses. Build 1,000 new hospital beds. That would have been the government's response. But now, with this life-saving vaccine, which could help us return to some degree of normalcy, as the Guardian editorial said last week, Friday, the baton has now been passed to the public to do what? Get vaccinated. So that is my answer, Clint. We can only provide so much bed spaces. There are no more doctors. There are no more nurses. We will try to accommodate as many people who are unvaccinated as possible. But if the Delta becomes entrenched in Trinidad and Tobago, like other countries, in first world countries, and in the Caribbean, there may come a time where you may not get that hospital bed because it will simply run out. Why? Because the uninitiated who believes in social media succumbs not to the virus, but to that misinformation and disinformation on social media. We are asking persons to protect this country, to protect the healthcare system. Simple. Get vaccinated. Thank you, Clint.
I think the question was answered when Richard asked it before, so I don't want to go over the entire answer. But just to say, the only way you could have 100% safety net of a virus not coming into any country in the world is to have no movement of people from one place to the next. So if there's no one coming into Trinidad and Tobago, no one leaving, that is the only way you could have a system that will guarantee you that 100% of the time that there's no movement of the virus. As long as people are moving across borders, they will take with them the virus and the variants. So again, I'll back to you.
Thank you very much, CMO. We move to the Express for your 2 questions. Good morning.
Good morning, everyone. Leo Surias from the Trinidad Express newspapers. My 2 questions are for Dr. Parasram. Doctor, have the children who are COVID-19 positive at this time been tested for the Delta variant? And if so, can you say if any have tested positive for the variant? Thank you.
Yes, the samples would have been sent to the University of the West Indies for testing. Again, meeting the criteria for an unusual presentation with COVID-19, and we would have sent it across for testing. The only 3 positives we had so far are with the 3 adult repatriates that we got. So if we do get anything more from University of the West Indies, of course we'll let the national community know as soon as, but those tests have not come back to us as yet.
Thank you for your question. We quickly move to Radio Tambrin.
Hi, good morning. Clayton Clark from Radio Tambrin. 2 questions. The great race is on this weekend from Trinidad to Tobago. Can the minister just give an update on the process and the necessary protocols that the power boating fraternity, has to do leading up to and on the day of the race? And second question, has the ministry considered incentives for taking the vaccines? If such incentives are in place, can you just enlighten those of us who are not aware of such incentives?
Thank you.
Thank you.
Thank you very much, Clayton. I know everyone is interested in the Great Race. So the protocols for this year's Great Race is the same as last year's. No crowds on beaches, no welcoming party in Tobago, and so on. So those protocols are in place. The Powerboat Association of Trinidad and Tobago would have written to us, and we would have given them certain guidelines to follow and hope that they follow them. On the other issue of incentives for vaccination, yes, we have been giving Trinidadians and Tobagonians a lot of incentives. You will not die. The best incentive we can give people right now is save your life. Don't be a mortality statistic. Don't be an HCU or ICU statistic. That is the incentive that we have been holding out from day one. Protect yourself. Protect the 6-year-old child in your household who at this time cannot be vaccinated. So all adults living now with children, you are incentivized to make sure you do not be the carrier of a virus that lands that 6-year-old child in an ICU. We have had 3. If I was a parent, that is the incentive I will need to protect myself and my children and my loved ones. Thank you very much, Clayton.
Thank you very much, Minister. We now go to TV6. TV6, good morning.
Good morning, Urvashi from TV6. Dr. Parasram, with regards to children who have COVID and are in ICU, I know you spoke about the strain not being yet determined. Could you give us an idea of the turnaround time it takes for these tests to be done, the extent of severity of the disease in these children, and if at all they would, any of them would have underlying conditions? Secondly, to you, Dr. Parasram, as you spoke about the Delta variant, you said that it's not, the risk is low of being transmitted from, to a vaccinated person. That risk is low. I was at the airport last night for the arrival of the Miami flight, and interestingly, I saw who I assume to be vaccinated person exiting the airport and going into the hands of their loved ones. They were hugging and so on. Yes, they were masked, but they were all hugging and so on. Given that it took 7 days for the virus to show up in the unvaccinated.
Okay. All right, thank you. We seem to have some technical difficulty, but we got the first question, and
yeah. So I mean, in terms of the, of course, we have to look at patient confidentiality. I could say that those 2 cases have gone home. There's one patient in the hospital in Cuba, I believe, at this point in time. The cases that require hospitalization by just virtue of needing hospitalization are moderate to severe in terms of the needs. It means at least that they need oxygen. I don't want to go into any further details, but I mean, Dr. Paul would have spoken at length about the risk of COVID-19 as it relates to children, especially the Delta variant. So I don't want to go beyond what she has already said. With regards to your second question, not sure. I think it's more or less what Clint and Richard was asking along the same lines about guaranteeing that there's no transmission and there's safety for persons returning. I think the onus is on all of us. If, for example, if you have those persons that are greeting the persons coming from abroad who are vaccinated, and those individuals are also vaccinated, you significantly reduce the risk of transmission of any disease, and of course severe illness and death from that particular illness. So we're asking everyone in the country, and we have said before that when you receive your loved ones from abroad, there's a period of observation and monitoring that the ministry will be conducting, but we're asking you to do the same and have personal responsibility. Make sure you wear your mask when needed, and of course if you have any signs and symptoms, you reach out to one of our sites, get tested, so that we do the necessary in terms of COVID-19. Al?
Thank you very much, CMO. We now go to the Guardian newspaper. Guardian? Okay.
Hi, good morning.
Okay.
Hello?
Yes, good morning.
Sorry about that.
Please.
Renuka Singh at the Trinidad Guardian. Minister Dialsing, I often ask you this, but it's just to get your feedback on it once more. Based on your trajectory of the numbers of vaccinated persons, are we on target? Are you still concerned that we're falling short, or have we gotten better based on your last figures? And secondly, Dr. Parashram, over the weekend, and I know I would like to revisit the issue of the sick children, the children who have COVID. Is it that the reportage is now changing where we're being told about younger children, or is it that we are now seeing children being impacted with the virus? Thank you.
Okay. Thank you, Renuka. So my original target, if you'd remember, was to have 600,000 persons fully vaccinated by the end of September. So we have a month and a half again to go. Right now, we are off the pace by about 50,000. By now, we should have been about 500,000 first dose on their way to 600,000. However, now that we have the opportunity to vaccinate the 12 to 18s, which were never counted at that time, it was always a percent of your total population, even though you had to minus 400,000. That will give us a significant boost to achieve the target of 600,000 fully vaccinated, hopefully, by the end of September. So I am still cautiously optimistic that once parents do the right thing by their loved ones, because as I say, I will hate to hear a child dying from COVID-19 in September because they weren't vaccinated. As a parent, if that was me and I took a decision not to vaccinate my child, and my child died from COVID-19, I don't know how I will live with myself, honestly. So I think now that we could vaccinate theoretically 90,000 persons, even though we have this current shortfall, I am confident that we can make it up. As a matter of fact, Living Waters community wrote to me this morning. They have 1,500 migrant children they want to vaccinate. And I said, fine, bring them. We'll make a block appointment for you at both Napa and Diwali Nagar when that opens up on Sunday. And we will gladly vaccinate those Venezuelan migrant children because it is open to any child between the ages of 12 and 18, regardless of citizenship, residency. So thank you very much, Renuka, for that.
Hi. Yep. So if I can understand the question, so basically we would have had cases of infection in children throughout the epidemic. When we saw the initial, when we had the community spread with P1, what we noted in Brazil, for example, at the same time is they had a very high level of morbidity and mortality in children, and noted with significant concern. And thankfully that has not occurred, although P1 seems to be the dominant strain in Trinidad and Tobago at this point in time. We are now noting with concern what is happening with the Delta variant in other parts of the world, the US, the UK, Canada, where you find that there's a decrease in the age of persons being affected, including children, and that is the concern we want to bring to the population, seeing that we are the 144th country in the world to have actually said that we have Delta. More or less, that is the majority of the world's population in terms of the WHO zones. We are concerned that it will affect children disproportionately for two reasons. One, because it may have a predilection towards that age group. And of course, we have been immunizing persons in a higher age group. So there will be, majority of those people will be, or if not all, will be unvaccinated at this point in time. So Dr. Paul could go into a little more detail before I close. Dr.
Thanks
Paul?
for that, CMO. Just to add to that, confirming we have up to 52 cases of MIS-C at the present time. So just to add to what CMO was saying, we have had sick children and we have had MIS-C cases continuing. But those three that was brought up in the last news conference was just to make sure and see, like, represent the story of the visual, to have those three patients in ICU and show that we're having a change, a slant in terms of the typical presentations we've been seeing. Also to add that the Pediatric Society of Trinidad and Tobago here, they are going to be sending out some more information to the public in terms of supporting both the Ministry of Health and the parents to make sure that they give you as much information in addition to what's been happening here with the Ministry of Health. Thanks a lot.
Thank you very much. I see a follow-up question from Guardian Media. Guardian Media, good morning. CNC3.
Yes, hi, morning. Thank you for unmuting me, TTP. So my follow-up question is I just want to get an update on the medical condition of the 3 Delta variant cases and the 3 children that was identified just now. I believe Dr. Paul would have mentioned that they are in ICU.
No, so I gave the update on the children already. In terms of the Delta variant, what I am told from the CMOH is that they were all very mild cases. They were 2 were mild and the other one was asymptomatic.
Thank you very much. We now go to AZP for a follow-up question. AZPnews.com. Prior.
Good morning again. Good morning. Minister, there are children in school who are 19 and 20 years. Would they be able to get the Pfizer? Thank you.
Thank you. So anybody over 18 is considered an adult, and anybody over 18, whether you are 19, 20, 21, 22, can access either the Sinopharm or the AstraZeneca. Okay? Thank you very much, Prior.
Did we go to CL Communications? Did we answer that? Nadaline?
Thank you, TTT, for unmuting me. Good day to everybody. I have just some small questions. Can you give an update on the long stay homes and the uptake of vaccines by the residents in those long stay homes? Secondly, uptake of vaccine by nurses is still relatively low. What is being done to boost or sensitize the nurses about the positives of the COVID-19 vaccine? And given that retail sector and other sectors of the economy is set to open, I was just wondering, has extra protocols or alerts been put at the hospitals just for to expect maybe a higher volume of people coming to the hospitals to get themselves checked, or if they have suspected symptoms? Thank you very much.
So, Natalie,
it's about 4 questions.
Could you just quickly repeat the question slowly? Please?
Yes, Minister. Okay, so the last one first. We're expecting increased movement of people in the country because more sectors of the economy are opened. Just wondering, have extra protocols in any part of the country been put in place so that...
Okay, good. So we have that. Next one.
Right. The second one is uptake of vaccines by nurses is still relatively low. What is being done to sensitize nurses about the positives of the COVID-19 vaccine? And then lastly, long stay homes. Can you give an update on the residents wanting to take the vaccines?
Okay, thank you very much. We got them. So I will take 2. I will take the nurses and the long stay home. So I spoke once again to the president of the TTRNA on Saturday to express my willingness again to work with his association to get vaccine rates up. Tomorrow I have called a meeting with all CEOs of the RHAs together with the GMs of nursing for all the RHAs to get an update on where we are with vaccinating nurses. Coming out of that meeting tomorrow with the CEOs and the GMs of nursing for all the RHAs, I will then reach out once again to President Eddie Stewart to offer them not only Sinopharm, because the last reason that was put forward was because nurses wanted to travel. We have reserved a block of AstraZeneca vaccines to them, so now they can take their AstraZeneca and travel. I will continue to dialogue with nurses, their representatives, and even individually. And the RHAs have been doing a lot of work for them. On the issue of long stay homes, I can give you some figures, but these figures are a bit dated because I tried to track these figures on about a 2-weekly basis. The last figure for long stay homes as at August 6th, so let me be clear, this is August 6th, the figures would have changed. Total residents receiving their first dose was 1,330. Total residents receiving their second dose, 769. Total caregivers given their first dose, 779. Total caregivers given their second dose, 494. So that is where we are with long stay homes. I must say, there are some long stay homes where the management and or owners of these have told us point blank we will not be allowed to either come into the home to even talk to residents because of their particular religious beliefs. But we continue to talk with them, encourage them, but we cannot forcibly go into any long stay home if we are not allowed to even talk to people about the benefits of being vaccinated. But that is in the minority. That's about somewhere between 3 to 5 homes of all the homes in Trinidad and Tobago. But it is a problem. It is a problem. And we have to respect people's religious beliefs at this point. Well, not at this point in time. Always. Okay? Thank you very much, Natalie.
Thank you very much, ladies and gentlemen. As we another question, I'm sorry.
No, I think there was a last question related to reopening of the retail sector. So if we needed an increased, a more robust policy, I think the policy is fine. What we can't control is the way people behave. And we have always said from the beginning of the pandemic, if you follow the guidelines, we decrease the likelihood of you getting the virus and, of course, the spread from one person to the next. So we are asking everyone to, of course, follow the guidelines as we continue to reopen different sectors. Wear your mask, wash your hands, watch your distance, and most importantly, vaccinate as many people as possible, so we try to get to a place where the viral level in the country is as low as possible. And even if you get the virus, the risk of severe disease and death is minimized. I think, Al, back to you.
Well, no better closing words than what the CMO has given to us. So as we wrap, I would just like to thank the Honourable Minister and the other panelists for providing us with the updates, the media for their engaging questions, and you, our listeners and viewers, for sharing your time with us today. Please remember to follow the COVID-19 health guidelines and protocols. They are available on the Ministry of Health's website at www.health.gov.tt and our social media pages. I urge everyone to protect themselves and others against COVID-19. Play your part by following the current public health guidelines and regulations. And finally, we ask that you protect yourself, your family, friends, and Trinidad and Tobago by being vaccinated. Please stay safe and goodbye for now.